neoplasia. This is the last chapter. So what is neoplasm? Neoplasm is uncontrolled cell division. It is uncontrolled cell division. So there are a lot of cell divisions happening. So there are increased number of cells forming a mass. That is what is tumor now. That is what is neoplasm. So how can you treat this? When there is increased cells, you have to kill these cells. That is what is known as cytotoxic drugs. So you're giving drugs to kill these excess cells. Now how does cytotoxic drugs act? It will kill all rapidly dividing cells. Rapidly dividing cells. So if you see carefully, it will kill the tumor cells, yes, because it is uncontrolled cell divisions, but the issue here is in the body also we have rapidly dividing cells, normal cells, it will kill those cells too. That is the issue. So if you see here, what are the common side effects of the cytotoxic drugs? It will kill the rapidly dividing cells in the body. These are present in bone marrow because they make RBC, WBC and platelets. Now, when these cells are killed, what will happen? RBC will decrease, it will cause anemia. Yes, WBC will decrease, it will cause leukopenia. Platelets will decrease, it will cause thrombocytopenia. This is what is known as pancytopenia. This is what is known as pancytopenia. Hair is also a rapidly dividing structure, so it will cause hair loss. And GIT also has a lot of rapidly dividing cells. When we kill GIT cells, it will cause mucositis. Because of this, absorption doesn't happen and it will cause diarrhea. And enterochromaffin like cells will be dead, and this will cause what? Release of histamines and serotonin. When serotonin increases, it will cause nausea and vomiting. Okay. Now coming to the cells, when there is lot of cell death, it will release purines, and purines will be converted into xanthines to uric acid. So there will be hyperuricemia. So this is what you see in all of the cytotoxic drugs. That is why we have made targeted anti-cancer therapy. This is the second class of drugs, targeted anti-cancer drugs. So we have cytotoxic drugs, targeted anti-cancer drugs. These will have lesser side effects in comparison to cytotoxic drugs. But for the exam, only the side effects are important. So we are going to do the side effects first. Yes. So if a person has anemia, what should you do? We talked about this in the heme chapter. What should you give? You should give erythropoietin analog. Yes, what will you give? It is darbepoetin or epoetin. Darbepoetin or epoetin. If a person has neutropenia, what should you give? GCF or GMCF? These are filgrastim, that is GCF, sargramostim, that is GMCF, that is GMCSF, colony stimulating factor. This is granulocyte colony stimulating factor. Granulocyte, G for G. Thrombocytopenia, I told interleukin 11 analog, that is oprelvekin. Hyperuricemia, what will you do? You can give rasburicase to decrease the uric acid that is already present. To prevent the formation of uric acid, you will give allopurinol. That's all. Now coming to the side effects. Let us suppose this is one person who had cancer. If a person has cancer, obviously he'll be sad. Yes, he's sad. Right. Now we'll draw the other structures of this man. These are his ears. These are his kidneys. Yes. Now I'm drawing the lungs. Now I'm drawing his heart. Look carefully how am I drawing his heart. I'm keeping one D, next T and an inverted T. You got 4 chambers. Yes. Now I'm drawing his bladder. You see carefully, this is the bladder and there is urine. Okay. These are all the side effects you need to remember. Right. First we will see C for cisplatin. C for cisplatin. C for cisplatin. You can see C here in the ears, C in the kidneys and even in the mouth. Yes, I have written C like this, even in the mouth. So what is it causing? It is causing ototoxicity, nephrotoxicity, and it will cause maximum nausea and vomiting. It will cause maximum nausea and vomiting. Okay. Now, see here, this is B. B for bleomycin, busulfan. Both of them will together cause, what is it? These are lungs, it is causing ILD, interstitial lung disease, pulmonary fibrosis. Amiodarone also causes this. We talked about it. Methotrexate also causes this. Yes. Now, coming to the heart. How did I draw the heart? D and T. D for doxorubicin and daunorubicin. Doxorubicin and daunorubicin. T for trastuzumab. T for trastuzumab. All of these will cause cardiotoxicity. Which cardiotoxicity will it cause? It will cause dilated cardiomyopathy. Dilated cardiomyopathy. So we are done with this also. In the bladder, how did I draw the bladder? It is a circle, no? So I call it cycle. It is cyclophosphamide. Cyclophosphamide. And you can see urine, how is it there? It is an I. Cyclophosphamide, I-phosphamide. I-phosphamide. I have drawn the urine red in color. So the person is having cystitis. It is hemorrhagic cystitis. It is hemorrhagic cystitis. That's all. These are the important side effects that you need to remember. Now, what else is there? Bleomycin can also cause flagellate dermatitis. Bleomycin can also cause flagellate dermatitis. Okay. You can see the peripheries, they are in the shape of V. Yes, V for the peripheries. So V for vincristine and vinblastine also will cause peripheral neuropathy. And then there is one peculiar syndrome which will cause a desquamation of hands and foot. Hands and foot desquamation is known as hand-foot syndrome. Hand and foot syndrome. Desquamation means peeling of skin. Hand and foot syndrome. If the skin is being peeled off, you will get frustrated. When you are frustrated, what would you say? See, it is given in the screen. Yes, this is 5-fluorouracil. This is 5-fluorouracil. Did you understand? 5-fluorouracil and capecitabine. So these two drugs will cause hand and foot syndrome. These are the side effects I wanted to remember from this chemo man. Now, if a person has vomiting, how will you treat him? Obviously, you will give ondansetron if it is early onset. Early onset means the vomiting is happening within 24 hours of starting the drugs. You will give ondansetron. Ondansetron. If it is more than 24 hours, that is late onset. Late means more than 24 hours. In this, you will give aprepitant. For nephrotoxicity, you can prevent it by giving a drug called amifostine. Hemorrhagic cystitis can be prevented by giving a drug called Mesna, but you can treat it with steroids. Cardiotoxicity can be prevented by a drug called dexrazoxane. That's all. These are the drugs that you can give for these side effects. Yes. So we are done with the rapid revision. I hope you understood all of this. Yes. Please revise all of this. You will be able to score well in the exam and answer most of the questions. Yes. Thank you.